Afternoon and welcome to this community briefing on our ongoing pandemic response efforts. Providing the interpretation for us today is Margie Prop. Thank you, Margie, and thanks to everyone for joining us. I want to start with some of the recent developments related to COVID-19 vaccine. Vaccine approval for children 5 through 11-year-old is likely to come very soon, adding about 29,000 people to the list of those who are eligible for vaccine and aiding in our community's progress in the fight against the virus. The U.S. Food and Drug Administration authorized use of Pfizer's COVID-19 vaccine for children 5 through 11 last Friday. However, the vaccine can't be administered yet. The CDC's Vaccine Advisory Committee is meeting today to discuss whether to recommend use of the vaccine among children in that age group, and then CDC will make the final decision. Our department has been planning and is ready to move forward if the CDC gives its stamp of approval. We met with the local pediatricians and other partners and have a plan to begin offering vaccine to children in this age group this weekend, if all the final approval is received. We'll be partnering with school districts to host vaccination clinics at the local high schools within the city and county. Vaccine will also be provided at local pediatric practices. They are currently providing COVID-19 vaccine to children aged 12 and up and have played an important role in expanding vaccination opportunities for children in our community. In anticipation of the vaccine approval, the health department has opened registration for 5 through 11-year-olds. Parents and guardians are encouraged to register online at covid19.lincoln.ne.gov. Those who are registered will be contacted to schedule an appointment when vaccine is available. People who don't have online access or need some assistance can call us at 402-441-4200. The best thing we can do right now to protect our younger children until they have the option to get vaccinated is to get vaccinated ourselves and wear a mask. People in our community are getting vaccinated every day, and we continue to work with various partners to host clinics so you can get a first dose, a second dose, or a booster to enhance existing protection against COVID-19. The CDC recently approved booster doses for Moderna and Johnson & Johnson vaccines. Now there are booster dose recommendations for all three available COVID-19 vaccines. Pfizer and Moderna booster doses are currently approved for the following groups at 6 months after their second dose: people 65 and older, and residents in long-term care facilities, people age 18 to 64 with underlying medical conditions that put them at high risk of severe outcomes from COVID-19, people who work or live in settings where they have increased exposure to COVID-19. Booster doses of the J&J vaccine are now recommended 2 or more months after the initial dose for all those who received it. The CDC recommendations also allow people to choose which vaccine they receive as a booster dose. Some may prefer to get the same type of vaccine that they originally received, and others may prefer to get a different booster. More information and upcoming clinics can be found on the city's COVID-19 webpage, again at covid19.lincoln.ne.gov. As I mentioned, several local pharmacies are also providing booster doses, and many offer all three types of COVID-19 vaccines. Find a pharmacy near you at vaccines.gov or by texting your zip code to 438-829. As we shared last week, the data tells us our local situation is still very concerning. And unfortunately, we have seen some of our indicators moving in the wrong direction. We experienced a decline in new cases in September. Then over the month of October, cases leveled off at about 80 cases per day. And toward the end of last week, we saw an increase of the 7-day rolling average back up to about 89 cases. Ideally, we would like to see case numbers drop to a sustained average in the range of 40 to 45 new cases a day. We have also continued to see a high positivity rate, back above 10%. As we have shared, we want to see a positivity rate down in the 5 to 7% range, which indicates that the risk of transmission is reduced. Our 7-day rolling average of COVID-19 patients hospitalized has consistently been under 100 patients since October 6th. But numbers are still too high, and local hospital capacity remains a serious concern for our entire community. At the end of last week, we remained about the same at an average of 89 patients. We need to continue to bring the number of COVID-19 patients down to provide some relief to our medical professionals and to make sure that those who are sick or injured can be taken care of quickly. Today, the hospitals report 100 COVID-19 patients hospitalized. 59 of those are from Lancaster County. In the month of October, 23 COVID-19 deaths were reported. This is up from 19 deaths reported in September. And sadly, today we're reporting the loss of 2 more people in our community, a woman in her 70s and a man in his 30s. So far, we've had 4 deaths in November. Due to the increase in new cases, our high positivity rate, and continued concerns with hospital capacity, the COVID-19 risk dial is moving back into the low orange category. Orange means there is a high risk of COVID-19 spread and impact in the community. Here on the charts shown on the color-coded risk map, you can see the indicators spread across the different risk categories. Our local positivity rate remains high and is in the red category, and our case rate has moved back into the red category. The death rate and hospital capacity remain in the orange category. Contact tracing is in the yellow category, while testing, turnaround time, and vaccination rate remain in green. The position of the dial is shown by the blue square outlined in red, which can be seen in the low orange area. Our risk dial provides a summary of current conditions in the Lincoln-Lancaster County community. It was developed to help communicate the risk of spread and the impact of COVID-19 in the community, and has been in place since its inception in May of 2020. Each color incorporates federal and national guidance published by public health experts. Our local situation remains concerning, and we don't want to lose the gains we've made. It's important to stay focused on what we need to do to decrease the risk of COVID-19 in our community, including getting vaccinated and wearing a mask. Those actions will help us push through this surge driven by the Delta variant. As I mentioned, there's a new development on the horizon that would aid in our progress, which is vaccine approval for children 5 through 11 years old. This is likely to come very soon. When it does, we'll be ready to start administering vaccine to that age group, and we will share more information about upcoming clinics. And with that, we'll take any questions.
This is Bailey with 1011. I was wondering if you have any numbers on how many people have received boosters?
We have a total of 11,840 people that have received boosters. 11,528 of those have been Pfizer and 312 have been Moderna. And remember, we just got approval for Moderna vaccine last week, so we started providing the boosters on Friday and Saturday. So we're in the initial phase of reaching out. We've primarily given Pfizer vaccine, but we have given Moderna as well. And by age group, really the 18 to 49-year-olds, we provided a little over 3,600 in that age group, and we provided a little over 1,600 in the 50 to 64 age group. And on the 65 and older, we provided a little over 6,500.
again, how big of a difference do you think getting boosters and then also having kids between 5 and 11 vaccinated could make on the situation in our community?
We remain very hopeful that it's going to make a large difference for us. And looking at those age group of children who are really unprotected now and seeing where cases are, it will make a big difference. You know, we have about 29,000 children in that age group, so we're really excited to be able to move forward there. The boosters we know are already a preventative method. Most of our long-term cares have completed their boosters, and there's work still going on to complete those final numbers, especially in our assisted livings and those other areas where we have people who are more vulnerable. Okay.
This is Bill from 11. There's been a pretty significant shift in hospitalized patients and where they're coming from, Lancaster County residents versus people from outside of Lancaster County. I know at the beginning of October, it was mostly from outside of the county. Now it's mostly from inside the county. Anything you can attribute that to?
You know, we're seeing in the younger population, Bill, where some of it is coming from. That's something we've been watching and working on diligently to see what could be creating that issue. And of course, there's going to be less people outside the county coming in when we have more people in the county. So we're continuing to assess that and see, but we primarily have, we know that a lot is in that younger age group. We do have some older adults as well.
Haley with 1011 again. One of the deaths that you reported today was a man in his 30s. How many deaths in that demographic of young adults have we seen, and why is that happening more?
Well, that demographic is part of the demographic that has a lower fully vaccinated rate. That's one of the bigger issues. And I'd have to get back to you on the demographics in that age group. Bailey, I just can't remember it right off the top of my head, but I will get back to you.
You've got that graph up on the.
Oh. It's on the dashboard. You can see. But I think just from the most recent times, we have some information we can get to you.
Pat, we have a question on the chat. Andrew from KETV is asking, what would you tell parents who believe natural herd immunity is better than the vaccine? And then do you have research either way?
There's a great deal of research that natural herd immunity is not effective in preventing COVID-19 at this point in time. Disease immunity exists to a certain extent, but there is research that shows that, and we can provide information.
And then Matt from the Journal Star is asking how much vaccine Lincoln will get for children during the first week.
We anticipate we should be receiving a shipment of over 4,000 doses, and then in a couple days later, we'll receive an additional greater amount. We're ordering in 3 waves. That's how the federal government's allowing that to happen throughout the states. So we feel that we'll be able to move forward rather quickly.
What would you tell parents who are hesitant or just weighing their options as far as getting their kids vaccinated?
I would tell them to talk to their healthcare provider and get information. We'll also have clear information on our website available to parents, and we'd certainly be happy to talk to parents as well and provide them with accurate information that can guide them in understanding the vaccine and making a decision about what's best for their child. I think, Bailey, it's really important to remember that this vaccine has really been rigorously tested and that it's been thoroughly reviewed. And those are some of the things I would tell parents in looking at making a decision.
We have another question. Any thoughts on why Lincoln, with a mask mandate and one of the highest rates of vaccinations in the state, is not making more progress against COVID?
I think that's all related to, what's happening all around us. And if you look at other states, I was on a call today and the hospital rate has increased even higher in Omaha. We're at 9.9%, almost over 10% capacity for hospitalization. The cases in Omaha have also gone up dramatically. I was on a call with the health directors today. The cases there are going up, but they're having different experiences than we are per se here. And just in surrounding communities, we've seen this happen where it goes up. And right now we seem to be climbing a little bit. We're hoping we're going to have a quick downward trend again. There's no easy answer for the Delta variant.
I just have one last question. We've been getting some comments from viewers that they're concerned that people aren't complying with mask mandates more and more where they're going, and how can the mask mandate work if there's no enforcement of it?
We've gotten over 400 complaints since August, and we follow up each one of those. Sometimes it means we have to go out and work with a location. Sometimes it's just education over the phone, and that generally resolves the issue. Sometimes we get complaints about individuals, and that's a little different situation about an individual. We don't know. They could have one of the exemptions for not wearing a mask. We have people, we work really hard to follow, I know, like at the volleyball games, for example, university is doing everything they can to remind people to keep their masks on, and unless they're eating or drinking. There are individuals that are just simply not going to follow, but the majority of people are still doing their best to follow, and that's what's helping us, and that's what's part of the problem. We all have to work together as a community if we're going to make the change that we need to make. All right. Thanks again for joining us today, and please remember to wear your mask and to get vaccinated.